So the VLAP is an implantable device that is able to collect the left atrial pressure in patients with heart failure with reduced ejection fraction. This device does not have a battery, but is able to transfer the data that he collects to the patient and then to the doctor in a cloud system. There is a specific app where the doctors can access from their computer or their app in which they can monitor the data that are recorded on a daily basis. So I come from a tertiary center in Italy, Fondazione Policlinic Gemelli, under the Department of Cardiovascular Thoracic Science, directed by Professor Crea, and we are part of the trial that is actually exploring the clinical application of the VLAP. During this meeting, we present the first case that we implanted with this VLAP, and we were able to show that after 3 months of the implantation, the recording of the left atrial pressure from the device are pretty reliable compared to the gold standard, that is the right heart catheterization. This is really a step forward because so far the gold standard for the monitoring of the filling pressure in the heart are related to the right heart catheterization. In this case, with this device, we are able to monitor on a daily basis the pressure of the heart and therefore personalize the treatment for patients with heart failure with reduced ejection fraction. Yes, it's implanted with an invasive procedure with a transseptal puncture under the guidance of transesophageal echo and fluoroscopy. So we are able to deliver the device in the right place, at the right time, and then check everything shortly after and then when the patient will be discharged. So heart failure is the price that we had to pay for the success of cardiology in the last 20 years. The burden of patients with heart failure is increasingly, constantly, and one of the problems is the readmission for the compensation of heart failure. The good thing is that in most of the cases, increase in pressure on the heart precedes the decompensation. Therefore, with this device, we were able to detect the early stage of the compensation, modify the therapy, and hopefully change the outcome of the patient with heart failure. So the trial that we are part of, we enroll 30 patients within 8 sites in the world. So we are moving forward to enroll more patients and see whether, first of all, there are data about the safety and reliability of this data, and therefore implement this technology on a wider range.